Hey, I'm Dr. Guzman, and I'm really glad you're here. If you've been doing all of the right things to improve your health, maybe you've been sleeping more, sleeping better, maybe you've been trying to eat well and move your body regularly, and yet you feel like things are not working, things feel harder than they should. I want you to know something really important, which is that you're not broken. There's nothing wrong that you're doing. You don't need to do more, and there's nothing that we need to fix. As a triple board certified physician in sleep medicine, obesity medicine, and internal medicine, with specialized training in mind body medicine, how the mind impacts physical health and the body, I've seen hundreds and even thousands of patients who struggle with their health. They feel frustrated, they feel stuck, they feel exhausted in improving their overall wellness. And one of the gaps I've seen in the traditional healthcare system is that we treat sleep and weight as separate problems. And the diet industry and wellness culture tells us we just need to try the latest supplement and do the latest quick fix and the latest diet. And what I've seen is that those short-term quick fixes don't work over the long term. So at Dream Life Medicine and Wellness, what I'm creating is a practice where we deliver whole person care, looking at everything from your labs and your medical conditions, medications that could be contributing to your health, ruling out sleep disorders, treating sleep disorders if they're present, but going beyond that into a neuroscience informed approach of behavior change, of understanding beyond metabolism what our emotions and what our behavior is telling us, and how we can, from a place of self-compassion and self-kindness and self-acceptance, begin to transform our health, not with a quick fix, not with anything external, but using our body's own ability to repair and recover, and using evidence-based tools to assist if we need to. So when we help our brain feel safe and supported and regulated, sleep becomes easier, and we improve our relationship with food, we improve our relationship with movement, our relationship with ourselves, our relationship with others, and life starts to feel a little lighter. We stop feeling like we need to be doing more and more. It rather feels like, what can I do less of that is draining me? How can I support my body in behaviors and food choices and things that actually feel nutritious and delicious? You can have both. And so instead of asking, why can't I stick to this plan that I created, a New Year's resolution that I'm so set on, instead of beating ourselves up when we stop doing whatever behavior we wanted to get us to that goal, we can start to shift the question that we ask, because the quality of our lives is directly impacted by the quality of the questions that we ask ourselves. So asking ourselves, what does my brain and my body need in terms of feeling supported in my health journey? At Dream Life, we focus on comprehensive sleep and weight care, focusing on the fact that sleep is not optional, it's foundational. Sleep affects hormone regulation, emotional regulation, blood glucose levels, your blood pressure, even your cholesterol, appetite, mood, motivation, executive function, your ability to think clearly and concentrate is impacted by sleep. And sleep is something we all have to do, just like we all have to eat in order to function day to day. So I think what brought me into these fields is how incredibly impactful behavior is to the way that we fuel ourselves in terms of food, the type of fuel we give our body, and the way that we use our body in terms of function, mobility. And that's what allows us to give and serve the world in the way that we want to, whether it's with family, whether it's at our job place. So weight health and sleep health is not about punishing ourselves. It's not about restricting. It's not about doing more and finding the right quick fix. It's about creating sustainable behavior change that feels supportive and using the evidence-based tools that can get us to our goal. So how do we treat weight health? How do we treat sleep disorders, right? We want to use the latest evidence-based tools, and that may be medications in some cases. but recognizing that behavior, our relationship with food, our relationship with movement, and our relationship with our body are foundational. And that starts from the place of how are we thinking about our health? How are we thinking about goals? Are we thinking to reach goals from a place of, I have to do this. I know I should do this because my doctor told me everybody else is doing this, so I must do it too. That's one way. And it may feel pressured and it may feel like we have to do it to please something that's external to ourselves versus why do I want to do this? Why is this important to me at this stage in my life? And at this stage in my life, what do I have the capacity to do in terms of my health? And it might just be a 5-minute walk after each meal, but that's impactful over the long term. And so if you're not someone that right now can fit an hour at the gym, what does 5 minutes look like? If stress is something that's impacting your health, potentially your sleep, what does it look like to set aside 5 minutes to regulate the stress response? So one of the biggest differences in my practice is that we don't separate the medical aspect from the mindset behavior aspect. Your thoughts directly shape your nervous system, and your nervous system shapes your habits. And so I often remind my patients that we want to ask ourselves supportive questions. Instead of asking, what's wrong with me? Why is this so hard? Why can't I stick to the goals that I set? Asking, what feels supportive today? What do I need today? What do I have capacity for? If I could do something small, what would that be today? If I didn't have to be perfect this week, what would I do differently? So Dream Life is for people who are tired of the quick fixes, people who want to feel better in their bodies and in their lives, not just hit a certain number on the scale. And I want to help support you from that whole person perspective, addressing what your goals and your lifestyle is and the things that you value. And how do we create a happier, healthier life for you? So I offer telemedicine in Georgia and Florida, if you're in either of those states. I also have a community where you can come in and join. It's support in a community of like-minded people who are on a health journey. And I would argue most of us are on a health journey. And my goal in my career in medicine is not just to see patients back to back to back. My goal is to help patients transform the way that they feel in their bodies, build more confidence in their health, and heal the patient-doctor relationship where patients may have felt like they were just a number on a list. And so if this approach resonates with you, I invite you to explore more here on my YouTube channel. I'm going to start sharing some videos that are educational. I want my people to feel supported, to feel seen, to feel heard. And that's why I created Dream Life. So thank you for being here. And if you like this video, give it a thumbs up. Leave me a comment if you have questions you'd like me to cover, or any suggestions for videos that you'd like me to make. I look forward to connecting more with the community and to showing up here and spreading evidence-based medicine from a whole person, holistic approach.